Welcome to Myo360, the podcast, where we'll delve into all topics related to myofunctional therapy, including airway health, snoring, TMJ, tongue ties, thumb sucking, and even bedwetting. As a myofunctional therapist and a formal dental hygienist, I am sharing stories and tips to help you identify if myofunctional therapy is right for you and how it works to improve your overall health. Join us while we explore the ever-growing world of myofunctional therapy. We have one goal in mind: to help you and your family live your best life. Hello and welcome to Myo360, holistic solutions for snoring, TMJ, better breathing, and better sleep. I am your host, Becca Rose of Myofunctional Pathways. Thanks again for joining us. So today, let's get deeper into tongue ties. Are you feeling tied down? What's going on? All right. So let's talk a bit about the causes and the treatments and the different kinds of tongue ties, because most people don't realize that there's more than one kind of tongue tie. So when I say that phrase, tongue tie, you have a tongue tie. Someone told me once, I have a tongue tie. What comes to mind? For most people, they think about the string that's right underneath the tongue, or they have a vision of a baby, an infant, a newborn, with that really tight little string right attached to the tip of the tongue, and they can't move their tongue. And then this causes lots of trouble for baby and feeding, and mama has pain and all of the things, okay? So both of those are versions of tongue ties, but there's another kind that most people don't know about. A lot of doctors aren't aware of, dentists, pediatricians aren't necessarily aware of what's called a mid-tongue restriction, or another way to say that is a posterior tongue tie. So the terminology of mid-tongue restriction or posterior tongue tie was termed by a ENT in Los Angeles. His name is Dr. Sharush Zaghi. He's the one that keeps all of this up to date. He provides the data, the research, the studies that talk about what's called a functional frenuloplasty. Now, what is a tongue tie to begin with? Okay, let's start there. So the tongue tie, part of it is about the string underneath the tongue, but what I'm looking for as a myofunctional therapist is what's called that mid-tongue restriction or posterior tongue tie. What is that exactly? If you've ever heard of fascial tissue is a very intricate and large organ. Well, I don't know if we can really call it an organ, but it's a large matrix. It's a structure of collagen and that fascial tissue, and it wraps all around every muscle fiber of our body. The deep frontline fascia actually starts right underneath your tongue and goes through your entire body, intertwined all the way down to your feet. So sometimes this posterior mid-tongue restriction can cause limitations in how well a person can engage their lung capacity or their diaphragmatic movement. It can impact pelvic floor issues, even plantar fasciitis or other foot concerns. That fascial line goes all the way through to your feet. So literally your tongue is connected to your toes through the fascial network matrix, okay? What does that mean? Well, what that means is there's not a lot of flexibility. That's a simple way to put it. So fascial tissue doesn't really have the ability to stretch or elongate over time like a muscle would. So when we work muscles, we stretch muscles, we strengthen them, we get elongation, we get strength, tone, coordination. We've got all these things that we can get with muscle function. We can't really do that with fascial tissue. So fascial tissue kind of holds everything together and then maybe prevents some of the muscles from moving or functioning the way they ideally should. Okay, so the fascial tissue, it connects underneath the tongue on these muscles, it goes deep. You can't see this part, okay? You can see the string, but you can't see what I'm talking about right now. It connects to the muscles underneath the tongue and then embeds and connects into the floor of the mouth. When that restriction is very tight, then we see lots of trouble with snoring, open mouth posture, clenching and grinding of teeth, breathing difficulties, lots and lots of things, because what's happening is that the tongue is not able to make full contact with the roof of the mouth. Why is that important? Well, the tongue has to be able to fully engage with the roof of the mouth to be able to create a correct swallow pattern. Okay. When you can't make that seal and you don't have a correct oral phase swallow pattern, then lots and lots of other muscles in your neck, in your face, have to do jobs that they are not intended to do. So we call those compensations. So if you think about, you have a bad hip, right? And say you fell, you injured your hip and you have a little bit of a limp and you're trying to heal. While you're healing, your body is essentially making other muscles, so maybe on the other side of the body, work much, much harder and strain much more to be able to make up for the job that that injured hip and all those muscles associated with can't do for themselves. So it's kind of the same thing that happens when we have trouble breathing. We have snoring, we have TMJ, clenching, grinding. If we are choking on food or choking on our saliva, can't swallow pills the same way we used to be able to, those muscles over time then start to get weak. And if they can't work functionally or properly, then maybe we have muscles in our neck that have to help, or muscles in our cheek that has to help. And then that strain over a lifetime starts to affect the rest of the body. The fascial tissue under the tongue can also play a role in making your skeletal posture worse. So maybe over time you start to find your head is coming forward a little bit, your shoulders are rolling forward, your posture is starting to change. That constant pull of fascia and the overcompensation of other muscles can contribute to poor posture that basically gets worse over time. Most of the time when people come here, they didn't know they had a tongue tie. Like, what? No one ever told me this before. What are you talking about? Sometimes though, clients come here and they're like, I know I have a tongue tie and I need you to help me because I need to get that released so that I can work my tongue properly, so I can breathe better, sleep better, stop my snoring or eliminate my snoring. And again, like I said, others really don't know that they have it. So they come here and they're like, whoa. But then the best part about that is that they get the aha moment. They get the yes, I finally have an answer. I finally understand what is contributing or what the root cause is to all these things I've been dealing with my entire life. It's important to know that a lot of these issues, the snoring, the poor breathing, the open mouth posture, the choking while you're chewing and swallowing, a lot of these things are present even when you're very, very young. And you aren't going to know it because you're a little one, and if your parents don't know, they're not going to know it either, right? So say you're a baby, that spit up a lot and you had colic and they gave you the little medicines for the gas in your tummy and said, oh, you'll be fine, you'll outgrow it. Okay. Maybe eventually, obviously the colic gets better, but maybe then you become a child who, gets really bloated and gets really gassy or has other digestive issues. And then maybe you're a really messy eater as a kid and your parents are frustrated because why are you so messy or why are you chomping with your mouth open? Usually it's not because they're trying to be rude. They're not trying to be rude. There's a component there that revolves around breathing. And if someone can't breathe well while they're chewing and swallowing, they have to open their mouth because the body can't swallow and chew and breathe all at the same time. So next time you are scolding your kid, or you look at an adult in a restaurant and he's sitting over at the table over there, just really loud and driving everybody crazy, I bet you almost any kind of money that that person has some sort of tongue restriction or breathing difficulty that is creating that behavior. Okay. So hopefully we'll look at that a little differently now with the open mouth chewing. I promise you, they're not doing it to annoy you. I completely just got off track, but let's bring it back in. Okay. Doctors. Okay. Let me start over. Patients come from their doctor's office or their dentist or their pediatrician. And sometimes they're really upset because, like, I have all these problems. I've mentioned, my teeth grinding to my dentist my whole life. And I've mentioned my snoring to my doctor. It's just like, you're fine. You don't have sleep apnea, so you're fine. But they're not okay with those answers. They're not okay with, I'm fine, because they know that there's something else. And then the doctor might respond by saying, oh, tongue tie, if you can stick your tongue out and lick an ice cream cone, or you don't have any speech problems, then you don't have a tongue tie. And then, so say the patient comes, we do our evaluation, their aha moment goes crazy, their light bulb is lighting up the whole universe because they finally have an understanding to why they're doing all these things. They go back to the doctor or the dentist and they're like, hey, tongue tie, hey, myofunctional therapy. And then the most discouraging and disheartening thing that ever happens is when that provider says, you're fine, you're going to be fine, you'll outgrow it. That's not a real thing. That's voodoo medicine. That's voodoo. That's the one that breaks my heart. When your provider is telling you that something about you finally figured out what that missing link was, and they look at you and they say, oh, that's witchcraft, oh, that's voodoo. You can't see me right now, but my mouth is hanging open, because can you imagine your doctor saying that to you? I can't imagine that, because this is someone that you trust. You put your confidence in them. You expect them to be able to guide you to answers to help with your ailments. And when they don't understand something, and because they don't understand it, they think it's voodoo and it's not real. I guess I'm pleading to providers of any profession, right? If you're not trained in something and you don't understand it, then please don't put it down. Okay? Just don't put it down. Don't insult it unless you understand what it's doing. Because none of us would be doing this if this was voodoo. And there's lots and lots of doctors out there that work in Airway and do functional tongue tie releases. And none of us, they are not going to put their name and their reputation on the line out there for the world if this wasn't real and this was voodoo medicine, okay? So please keep that in mind. If you just know in your gut that something is different, there's another answer that hasn't been thought of, and then you have your myofunctional therapy evaluation and your light bulb goes crazy, the light bulb goes off, you are in the right place. And usually the people who come to find us are the ones who have tried everything else. And then through searches of their own, they figure out, hey, I think I have this tongue tie because I've done this. I have this. And my doctor has said this, and none of it's worked, and say it's been 20 years and you still have no answer. So the tongue tie will not stretch on its own, because earlier, if you remember, I said that's fascial tissue, it's connective tissue. It does not have the ability to stretch enough to be able to change your function or to improve the mobility, especially of the back part of the tongue. So just keep that in mind, okay? What we do though is we get the whole tongue body ready, the muscles of the tongue. Because if you're going to have a tongue tie release, You want to make sure the muscles are really strong and they have endurance, built-in coordination, and tone is a really big one. Because as you tone and strengthen the muscles around the tongue tie, around that fascial tissue, it allows the tissue to almost pop out more. And you can't always see that because, again, it's behind the string where you can't see it. But while the doctor is in there working, they are like, oh, this is fantastic. This tongue is ready to be released. All that fascial tissue is right there. It's up front and center waiting to be released. And that's what's going to give you the best outcome. Now, it's important to know that, you can have a frenectomy. That's what another term that a doctor, a dentist, or anyone who's trained to do that can do, where essentially they use scissors or laser, and they just snip the tongue. They just kind of make like a cut through it and send you on your way. Although that's not a procedure that is, you can do that. You can do that, but that's not the same thing as the kind of tongue tie release I'm talking about. That's going to help more the front part of the tongue. And like when we see that baby who just cannot lift the tip of their tongue off the roof of their mouth. This is a different kind of tongue tie, okay, with different reason for a different purpose. But I would caution you, if you were ever at, a doctor's office or a dentist office and you said, yeah, I think I have a tongue tie. And as good as their intentions are, and like, oh, you know what? I can help you with that right now. I'll go get my laser. Please don't do that on the spot. Get a second opinion, seek out the services of a myofunctional therapy, a therapist, so you can understand how that might not be so helpful in the long term for what your specific symptoms are, okay? If you're tied all the way down, that's a different story. But if you're having trouble with snoring, or the water's going down the wrong pipe all of a sudden, or it's getting harder to swallow pills, or, your breathing isn't as good as it used to, find out why before you do that, okay? Because you don't want to end up having more scar tissue form if that tongue wasn't ready for the release, okay? So that's my little word of, I don't want to say caution because that's not really caution, but that's my word of advice. Anytime you have a procedure done, you want to understand why you're doing it and what the purpose of it is and how it's going to help you in the long term. Let's talk a little bit more about symptoms that are related to a tongue tie. I mentioned some of them already. So some of the symptoms that you may experience, the sleep, the snoring, the clenching and grinding, all of these things tend to get worse as we get older. As I mentioned earlier, if the muscles in the oral facial complex, in the tongue, in the back of the throat, in your face, if they're not working to their full potential, as you get older, they start to lose even more tone and strength and coordination. Just like if you aren't good at walking upstairs and you never walk upstairs, or you don't have stairs in your house, and then all of a sudden you walk up just even 10 steps, you're going to be, your muscles are going to be tired. Your thighs are probably going to hurt for a day or two because those muscles are not used to doing that. So you have to get them nice and strong and ready to go. As we get older, those muscles lose even more tone because they weren't worked adequately for the whole duration of your life. So just recently, I had my own tongue tie release. I've been practicing myofunctional therapy for 3 years, and I just had my own tongue tie release, my own functional frenuloplasty. I am so glad that I did it. People ask me, well, why did you wait so long? And the reason I waited so long was because through teaching my clients and learning myofunctional therapy for myself, I've been able to improve my function significantly. I could elevate my whole tongue. I was able to eliminate my snoring. I had sleep apnea since I was 28 years old. I was able to keep that under control. I can maintain my functional seal. The reason I ended up doing the tongue tie release was to help with neck tension, especially in the front of my neck, down like through the front of my shoulders and my collarbone, because we hold a lot of tension in this whole part of our body, in our face, our mouth, our neck, right? There's a lot of tension there. There's a lot of anxiety there. And I ended up doing the tongue tie release so that I could release some of that tension. Now, remember, that's fascial tissue. So once you release the first chain, link of the chain, everything else starts to unravel just a little bit. You eliminate some of that tightness, and then it helps the rest of the body. So it's been about a month now since I had my tongue tie release. And I just every day I elate over how much better I feel. I'm sleeping better. My tongue is even more up in the roof of my mouth than I ever thought it was even possible before. I've been tracking my sleep. I haven't worn my CPAP machine for a month. It's been fantastic. Do keep in mind though, don't ever stop using your prescribed devices, sleep devices or TMJ, clench grind devices. Don't stop using your devices unless they tell you it's okay, that it's safe to do so. But often with, good therapy, we can eliminate or even reduce the need for that, depending on the severity that you're walking in with. But before you do that, you want to make sure you go through the proper steps to make sure it's safe. So I just wanted to throw that out there. Don't just stop using your CPAP machine until you have a sleep study and you reevaluate your progress, okay? But for me, I was able to stop my CPAP machine. I haven't worn that for a month, and it's fantastic. Not having that thing on my face because it's been there for 14 years. So I'm really happy about that. So we talked a lot about the different kind of tongue ties. We talked about what kind of symptoms come from that tongue tie and what some of the long-term implications can be if we don't address them, right? The symptoms tend to get worse, okay? So we offer a free discovery call. Let's get on and do I have a tongue tie discovery call, free 30-minute call. Visit our website at myofunctionalpathways.com. Click on the schedule button, and there you will find the link to schedule your free call with me. We will talk about your symptoms, what you're experiencing, and then if it seems like you're going to be a good candidate for myofunctional therapy, then we'll move forward and schedule a full evaluation and find out what we can do to help you. So thanks again for listening. Keep an eye out for our next episode and hope to see you soon.
Now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition.